Now let's come to the treatment of esophageal cancer. Esophageal cancer is one of the rare cancers which requires treatment from all the modalities of cancer therapy that there are. Now it requires surgery, it does require chemotherapy, it requires radiotherapy and also bits of immunotherapy to complete its whole treatment. Firstly, surgery, in which we try to remove the esophagus. Traditionally, this used to be done with 3 incisions, which is one in the chest, one in the abdomen, and one in the neck. We usually use the stomach to replace the esophagus and join the stomach by moving it through the chest into the neck and then securing it and joining it across to the remaining esophagus. There's also chemotherapy and radiation therapy, which can be used either before or after your surgery to kind of complete the treatment. Now this is where the 2 major malignancies which I had taught earlier will come into point. The squamous cell carcinoma requires chemotherapy along with radiation therapy, while the esophageal cancer of adenocarcinoma requires mostly chemotherapy in a sandwich way. Along with this, immunotherapy can also be used. It is used primarily in squamous cell carcinoma. Along with that, even in metastatic cancer, immunotherapy can be used. One of the major questions again that the patients do ask is what are the complications associated with esophageal surgery. Now, esophageal cancer surgery or esophageal resection is a very major surgery and a morbid procedure. Because it requires opening up the chest, abdomen and the neck in itself, you can have plethora of complications that can happen. The most usual complications that are associated with large surgeries, like you've got cardiac problems in patients who've got heart issues, along with that DVT or deep vein thrombosis. But the major complications which are very specific to esophageal surgery include anastomotic leak, which is leakage of the joint which is created in the neck or in the chest sometimes. Along with that, you can have pneumonia, and a later one complication can happen, which is known as stricture or a narrowing of the esophagus. Now, there's also another technique which does help reduce the morbidity and the complications associated with esophageal surgery, that is minimal access surgery or robotic surgery. It is usually done through keyholes or very small holes, which reduce the pain, thus reducing complications in the post-operative period and increase your ability to get back up on your feet again after the surgery.